The views and opinions expressed on this program are not those of Norfolk State University or WNSB-FM. Thank you for listening.
It's Hampton Roads Voices on Hot 91.
July is Minority Mental Health Awareness Month, and we're looking at Black children and mental health. How can you tell if your child is just acting out or if there's a mental health issue? How do I talk to my child's teacher about my concerns? And should my child take medication or enter therapy? Hi, everybody. I'm Benita Adams, and today on Hampton Roads Voices, Black children and mental health. Right after this on Hot 91.
It's Hampton Roads Voices on Hot 91.
Hi, everybody. I'm Benita Adams, and this is Hampton Roads Voices, where people speak life into their communities. Today, we're talking about Black children and mental health. As you know, July is Minority Mental Health Awareness Month, and we have to think about it in terms of our children. Today, we have two in-studio guests. We have Cynthia Choi from Transitions Therapeutic Services. She is a licensed clinical social worker. Welcome, Cynthia.
Thank you for having me.
And then we also have Kristen Bates, also LCSW from Kempsville Center for Behavioral Health. Thank you so much, Ms. Bates, for being here.
Thank you, Benita, for having me this afternoon.
Well, ladies, because it is Minority Mental Health Awareness Month, it is really important to look at all aspects of mental health. I think so many times we look at the physical health. We think about our children physically fit. We take them to the doctor. We take them to the dentist. But sometimes we forget about that other part, which is the mental, the psychological. So I want to start just talking about the difference between mental health and mental illness, and we'll look at several aspects of that. Cynthia, I'm going to start with you.
Okay. Well, one thing that I would like to say is mental health overall is focusing more on your emotional and mental well-being. When you look at mental illness, it's more for someone that may have a mental health diagnosis. Mm-hmm. So when you're thinking about mental well-being, you're thinking about when you talked about people focusing on their physical health, their mental well-being, they want to be happy. They're looking at their overall quality of life versus if they have a mental health diagnoses such as depression, anxiety, PTSD, things like that. That's more of the mental illness. Definitely.
We're going to get into some very specific with that. But we want to make sure that you join the conversation. It really isn't a conversation without you. It's 757-823-9110. We want to make sure that you ask the questions that you want to ask and tell us about your experiences. Has your child's behavior been misdiagnosed perhaps as a mental health problem or mental illness when perhaps it really wasn't? Or how did you approach school administrators or teachers when it came to your child's mental health illness, mental health issues? 757-823-9110, Hampton Roads Voices. Now, Kristen, the same kind of thing, mental health, what does it involve and how is it connected to our physical health?
Sure. And just like Cynthia said, our mental health is sort of our well-being, so our emotions, the way we think about things, our feelings, how we are able to problem solve and overcome difficulties, whereas sort of comparable to physical health. Everybody has physical health. We all have mental health. But not everyone has a diagnosis of diabetes or hypertension, just like not everyone has a diagnosed disorder of a mood disorder like depression or bipolar. And they're connected because sometimes the symptoms will manifest into physical things. Mm-hmm. So sometimes we see children who have anxiety, and so we might see them tremor, or we might hear them say that they have upset stomachs. We might see that people having depression might say, oh, I'm sleeping too much, or hey, I'm not sleeping enough. So those will be some questions or some answers that you want to provide to your clinician or your providers to kind of let them know, hey, I have these physical things that are going on with me. Can we sort of take a look to see if it's more physically related or if it's more a mental health issue?
Definitely. And I like that you said that because when I was doing my research, and we will look at this a little bit later, but it talks about symptoms, sometimes irritability, or as you said, that stomach or that headache or lack of interest or low energy, and you see that. But then sometimes I was wondering when I was doing my research, and how do you know that it's not just a 2-year-old being a 2-year-old or a 3-year-old or a 5-year-old, just being who they are, versus they're having some sort of mental health issue or something's going on? Cynthia? What about that?
So some of the things that we look at are not just the symptom itself, because we can pull out the DSM and, okay, this person has this symptom, this symptom, this symptom. But it's not just that easy. We sit down with the child. There's different types of interventions. You can do art therapy, play therapy. You also talk with the family, see what changes have gone on within the home, within the school, or within their lives in general, in their overall environment, because all of those things play a part. And let's say, for instance, you have a child that, before they were sleeping okay. They had a healthy appetite. And then over the last 2 weeks or over the last 30 days, they haven't been sleeping. They've been waking up in the middle of the night. They haven't been wanting to eat as much. They have been more irritable. That's when you really want to look at things, because then there's a change from what the norm for that particular child is.
And that really is what so much that I read said. If there's a major change, maybe there's divorce. Maybe there is a parent who no longer is in the picture, or a parent who is in the picture now. And so some of those major changes can cause some changes in their eating and sleeping and in school and so forth. So have you seen anything like that with your children? Call us at 757-823-9110. Hampton Roads Voices, 757-823-9110. We're talking about children, especially black children, and mental health in connection to July being Minority Mental Health Awareness Month. Now, where do genetics play? How do they come into play, Kristen, as we talk about this issue?
Sure. So when we talk about mental health and we're talking about assessments for, what are we looking at? What are the symptoms? One of the key components is that we're going to get a complete assessment. So we're going to look at the medical history. We're going to talk to the parents or the caregivers about their family's history with mental health, because studies do show that children or people who have mental health illnesses could be predisposed from a relative. So some of the things that they're experiencing could be something that a parent has experienced before. So when we sit down and we do our assessment, we're going to ask those questions. Hey, tell me a little bit about yourself. Tell me a little bit about, the immediate family members, because sometimes that does help paint the picture. That if mom and dad had depression, it could be likely, not always, but it could be likely that child will have some difficulties with that emotion regulation.
I can see that, definitely. So 757-823-9110. We're talking about black children and mental health on Hampton Roads Voices, where people speak life into their community.
It's Hampton Roads Voices on Hot 91.
If you're just joining us, I'm Benita Adams, and welcome to Hampton Roads Voices, where people speak life into their communities. We're going to go right to the phones, where we're talking about black children and mental health on Hampton Roads Voices. And in studio, we have our guest expert, Cynthia Toy from Transitions Therapeutic Services. Cynthia, thank you for being here. Kristen Bates, licensed clinical social worker from Kempsville Center for Behavioral Health. Thank you so much, Kristen. And just joining us now, we have Dr. Earl Williams, the director and owner of Psychological and Forensic Services. Sir, thank you for being here. Now, we were talking about the difference between mental health and mental illness, and then we looked at genetics and so forth and what's going on with that. So what's important is, let's go back over that just a little bit. We talked about the symptoms and how can a parent know? Again, we'd like you to call us at 757-823-9110. At what point did you decide that your child needed some help, perhaps in his or her behavior? Maybe you decided to take them to a therapist. Maybe you decided that medication was the way. How did you make that decision? And how did you talk to your child's teacher? Again, 757-823-9110. So, Cynthia, let me start with you again and ask you again, how would a parent decide that there is something going on with my child and I need to approach my child's teacher or administrator and so forth? What would he or she, the parent, need to have seen in that child in order to say, I need to talk to the teacher now?
Well, Benita, some of the things that they would look at is, like I said, the changes in their behaviors. So if they're sleeping more or sleeping less than they used to, changes in their eating patterns, if they're eating more or eating less than they were, maybe that child is more withdrawn than they used to be. They may have been outgoing, and now they seem a little more, a lot of people will say, oh, my child was never this shy, but
Right.
not really realizing that maybe they're having some internal fears, they're withdrawn, things like that. Or a lot of times, especially within the school system, a lot of mental health symptoms are seen as behaviors. And so a person or a child may be seen as the class clown, or maybe seen as, defiant, refusing to follow directives, or even maybe very impulsive. And so at that point, that's a good time for that child's parent to reach out and maybe get an assessment done, so that way they can determine if there is a mental health diagnosis or if there's not. And just because sometimes there's nothing wrong with counseling, even when there's not a mental health diagnosis as well.
Absolutely. And I like that you say that sometimes parents know, they can see the difference there in their child, who he or she used to be, who he or she used to be, and how they are now. And again, what is your experience? 757-823-9110. Call us with your feedback. How did you approach your child's teacher? Have you seen some changes in your child that made you think about perhaps there's something going on? 757-823-9110. We looked at the genetic aspects of it and the environmental causes. Now, Dr. Williams from Psychological and Forensic Services, how do you factor in the environmental aspects that a child, especially a black child, goes through, is a part of, that has an effect on his or her mental health?
Well, in doing an assessment, we're always going to look at collateral information. So we're going to ask other people about the behavior of the child. That might be looking at getting opinions from the parents. We want to look and see whether or not the parents are having a problem, because oftentimes children will display the symptoms of the parents' problem. So we have to look at that and consider that. We'll look at extended family members, and talk to them about the child, and depending on the age of the child, if it's useful or called for, we might even look at psychological testing, for the child or for the parents, because a lot of things that go wrong with people are familial. In other words, there are certain mental illnesses that are genetic and are inherited, things like ADHD, depression, schizophrenia, bipolar disorder. A lot of these disorders are passed down in the family. So you're not only going to want to look at the child, you're going to want to also look at, like I said, collecting collateral information from different family members.
That part really is important, because if you think about things that are specific to the black child. Now, Kristen, are there any particular mental health issues that are really particular to the black child?
Benita, I don't think that there's any one that is particular to black children. However, we do, in my environment, we often see sometimes children who, Cynthia had talked about, we see them in school and maybe the teachers will say that they have bad behavior. And so then we might see someone say, oh, well, they have ADHD, or, oh, they have oppositional defiant disorder. They're just oppositional. However, we do see a wide range of mental health diagnoses within the black community.
Well, why is it that sometimes not professionals necessarily, but professionals in terms of teachers, administrators, and so forth, can label a mental health issue as bad behavior? Is it so very much alike, or how can it be seen, one thing seen as a different kind of thing? Dr. Williams.
Oh, well, I was just thinking about that, that excellent response that the social worker just gave. One of the things that you haven't mentioned that goes into a complaint of a child, or the accusation that a child has of mental illness, is race. Oftentimes, black children are punished more often and more severely than white children.
Absolutely.
Boys are sometimes punished more severely than girls. So oftentimes you will have teachers trying to make the diagnosis of a child having attention deficit hyperactivity disorder and they have no right to do that. They have no qualification to do that. They have no training to do that. And oftentimes what I find, and maybe it's different for different people, sometimes people try to use drugs for things like ADHD to control the classroom, So you have to take a lot of things into consideration when you're looking at it. My son was diagnosed with ADHD, and I had to go to the school and I had to deal with the teachers in terms of the way they were treating him.
Absolutely. We have a caller on the line. And caller, what is your name, please? You're live on the air, and where are you calling from?
Hi, I'm calling from Virginia Beach.
Yes, and what is your name, please?
It's Nikki.
Nikki, what is your question or comment?
Well, I have a comment. I'm a fairly young mom of a 7-year-old who, in kindergarten did perfectly well. First grade, he did okay. And it wasn't until the last portion or the last semester where I noticed, and not just myself, but also his teachers, where he was acting out in class. Mm-hmm. But the thing was, as a mom, this wasn't a normal act out, and the teacher knew it wasn't a normal act out. And it went from the speaking with the teacher to meeting with the guidance counselor to meeting with his PCP, because at this point I knew this wasn't normal. And then, of course, speaking with the PCP and getting referred to, seek counseling or mental health for my young son to prevent this type of, explosion. So it's just pretty much for me, it was just being aware. And, of course, my spouse, knowing that he had some mental health issues within his family, it was important for me to address this head on, because if this be the case, I would like to catch it early.
Absolutely. And what did you decide? Did you approach, and how did you approach the teacher or the administrators to say, this isn't normal, something is different? How did you approach that? Because a lot of parents, they're not sure where to start with this.
Before I even approached them, they dealt with my son in the very beginning. My son was a model student, got awards and everything. So when he had this huge turnaround, they were like, okay, they kind of excused the behavior more than the first couple of times. And when it continued, they were like, this is not normal.
Okay, so they knew.
At that point, they knew, and I knew it wasn't normal. So that's what kind of led me to reach out to his provider. I didn't know what else to do.
Absolutely. Nikki, thank you so much for that call.
You're very welcome. Have a good day.
Thank you. Kristen, what do you think about that? I know you've probably seen that many times.
Sure, Benita, I have. And I used to also work in the school system myself. And so, excuse me, a lot of times, I'm glad that Miss Nikki said that she reached out to the teacher and she reached out to the guidance counselor, because a lot of times it takes for the parents to be able to go and advocate and kind of say, hey, guys, something isn't right. You're telling me that this is what my kid is doing in school. This isn't normal behavior. I think oftentimes, sometimes in the school system, the lack of understanding about mental health issues, it's difficult because we see it as sort of acting out or bad behavior. And so having the teachers, sometimes it takes just 5 minutes a day to talk to a child, to get to know the child, to know their stressors at home. Hey, did you eat this morning? Hey, let's talk about last night. Those conversations from the teachers, you can pick up so much from the kid and kind of determine, hey, something isn't right, something isn't going on. We talk about trauma-informed care. So just being understanding of some of the traumas that our inner city youth go through, and being able to understand that it impacts them in their school environment. And so I'm glad that Nikki reached out to her teachers, reached out to the guidance counselors and sort of said, hey, this isn't normal. Let's sit down, let's have a round table, let's talk about it, and let's come up with some behavioral interventions that we can put in school in place to help my child succeed.
I think that part is critical. 757-823-9110. Have you had to have that conversation as Nikki had about her son? And just as we heard, you've got to be an advocate for your kids, because teachers have a lot of children, and they have to maneuver through a lot of different things. And so it is important to be there for our kids. What have you done in terms of your child's mental health, or any mental health issues that you've seen, or behavior issues that you've seen with your child? Give us a call, 757-823-9110, 757-823-9110. This is Hampton Roads Voices. We're talking about Black children and mental health on Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. I'm Benita Adams, and this is Hampton Roads Voices, where people speak life into their communities. Let me go ahead and give you the phone number, because we really want to hear from you. That is 757-823-9110, 757-823-9110. What have your experiences been with your children's teachers and administrators? Have you seen any behavioral differences or changes in your child? What about his environmental factors? We talked about nurture and nature, but Black children and mental health. Let me reintroduce our guests. We have Cynthia Toy from Transition. She is a licensed clinical social worker. We have Kristen Bates, also a licensed clinical social worker from Kempsville Center of Behavior Health. And we also have Dr. Earl Williams, director and owner of Psychological and Forensic Services. Now, right before the break, we were talking about from our caller, Nikki, who said that she saw some differences and some changes in her son's behavior that was very different than how he used to be. But let's talk specifically about Black children and how in the school system, how it is different. Some of the statistics, as I was preparing for the show, it says the U.S. Department of Education, the Office of Civil Rights, says that Black children are suspended and expelled at rates 3 times higher than their peers. It even says that sometimes a Black child, is looked at his behavior and they're given a timeout, detention, or suspension. So there has to be a difference in how schools see Black children over other children. So, Dr. Williams, I'm going to start with you. Talk about that piece as it relates to the Black child.
There is a phenomena called the school to prison pipeline.
What's that?
What that is the training of a child through punishment to have them ready to go to prison. Because that's what if children will live up to or down to whatever your expectations are of them. That's just the way children are. And a lot of times Black children are expected to end up in prison, and so they kind of groom the child for that. So if you have one child that is fresh to a teacher, that child might get a 1-day suspension. You have another child that is fresh to a teacher, they'll get expelled. They will have to go to court to get back into school. So right away you're starting to give this child a record.
Right.
And so even a juvenile record can have a really negative effect in a cumulative way, because you get 3 or 4 of those, so that by the time the child gets out of school, they're ready for prison as far as the system is concerned.
And that is an amazing thing to me to even hear that. We have a caller on the line. Caller, you're live on the air. What is your name, and where are you calling from, please?
I'm calling from Chesapeake. My name is Barbara.
Barbara, what is your question or comment?
Okay, wanted to comment about the lady had called in, and she was speaking about our child and how we do need to be our child's advocate. Because living in today society as adults, there's so many different things that we have to deal with, and how much more so our children have to deal with. But firsthand, you think about it, if mental illness, if it's addressed when they're young, it is better for them, because if it's not addressed, it's going to continue and it's going to be a part of their life. And they're going to label the children. So the best thing to do is be there for your child. Be that advocate for your child. Sit there. If you have to go in the classroom, observe the behavior, and you can get help if needed.
Absolutely, Barbara. Have you had to be your child, or have you been, I would imagine, your children's advocate? And how did you work that system in talking to the teachers?
Well, think about it. Many years ago, everything was labeled with alphabets. They had attention deficit. That's what the label was when they were a little hyper, when they get a little bit more sugar than they think they should have. So therefore, everything was labeled. But what I did not refer to medicine. I went and I observed my child because I did not want them to be labeled for the rest of their life and also be on medication. So therefore, you do what you have to do as a parent and don't let society dictate what your child needs to maybe be on this type of medicine or that type of medicine. It's more to it than being on medication. There's many ways to work around a lot of different things. When I was growing up and there was things going on, there was nothing. You didn't say, they were not labeled as attention deficit or this and that. You had quality time with your children. You talked to them. You wanted to see what was on their mind, and therefore you were able to get the help that you needed, not your child being labeled and it going on with them in, to society, labeling them as this or that. But just be there for your child. We're living in critical times.
We are living in critical times. Robert, thank you so much for the call.
Thank you.
Miss Benita, if I can just add, thank you, Barbara, for calling in. And you're right that medicine isn't always the solution to the issues. And one of the things that we want to talk with parents about and we want to talk with kids about is just being able to recognize those symptoms, being able to recognize their own behaviors, and then being able to cope with it. So if I see that I'm getting restless or fidgety, what are some things that I can do in this moment to address this? What are some interventions that my child's teacher can put in place in the school to help them get through the school day? Maybe we talk about behavior modification. So we want to pinpoint a behavior and then modify the behavior. So being able to collect that data to sort of say, this is the behavior, how can I modify it, and then have in-classroom interventions to be able to address it. And same at home. These are the behaviors at home. This is what I want to address. This is what I want to change, and how I can do that at home.
And can I? I'm sorry.
Absolutely. Go ahead, Dr.
No, I just want to say that one of the things that people don't really understand is that two things. One is there is no psychotropic medication that cures anything. It doesn't cure anything. All it does is address some symptoms. The other thing is that all of these medications for children were designed for adults. Mm-hmm. And so they just titrate it down for a child. The other thing that you have to be very, very wary of is that medications for children can have side effects that can be really, really harmful. Because with Adderall, for instance, one of the side effects is psychosis. They might start hearing voices, So you have to be very, very careful about these medications that they're giving your child and pay close attention to what's going on. Because a lot of times mental health professionals, not all, but many, will use drugs as the first resort instead of using drugs as the last resort.
Now, and that really leads me back to when we were talking about black children. And Cynthia, I want you to jump in here as well as Kristen, but about that black child, and maybe they label that child as having behavioral problems and say, okay, he or she automatically has ADHD. I remember my oldest daughter, and she's actually a very meek, mild person, even as an adult. And the teacher had told us the week before that she had gone to a seminar on ADHD. And so she labeled my child ADHD, and I was like, that can't be. This girl, she doesn't have a combative bone in her body. She's quiet. She's studious. And I saw that immediately, and I had to be an advocate for my daughter and say, oh no, that was nice you went to that seminar and everything, but you can't come back and just throw that on my child. So what have you seen, especially with the timeouts and the suspensions and the things that we're talking about, especially with the black children?
And I think they do give more suspensions, more timeouts. What I think is more needed is more time in, because a lot of times what happens is you never know, a child may not be having their needs met, and that may be a reason for the acting out, and maybe they need some time in. And then you also have to think about it as qualifications for making these diagnoses.
That's right.
If you are not qualified to make a diagnosis, then you should not be, throwing it out there to a parent that also doesn't know what's going on, and then they're a lot of times going home fearful, scared, wondering what's going on. And then, in today's day and age, we have the internet. A lot of people are then saying, well, the teacher said this, so I need to go on the internet and research this, and then putting up symptoms. And then before you know it, they're like, I don't know what's going on with my child.
Oh, absolutely. The internet is a wonderful thing, but it's a tool that if we don't use it properly, we can be careful because people will start throwing out diagnoses. I read that. You must have that. We have a caller on the line, and that caller is called at 757-823-9110. You're live on the air. What is your name, and where are you calling from, please?
My name is Queen. I'm calling from Norfolk.
You said Queen?
Mm-hmm.
Okay, Queen, what is your question or comment?
Well, my question is, I have a child that I'm taking care of. It's not my child, but a child that I'm taking care of that has a mental health diagnosis. And his father also had some diagnoses. And I guess my question is, what do you do when you have a child with a mental health concern who is, growing up? Right now he's 9 years old.
Mm-hmm.
And he's growing up, but he's showing interest in, other little girls in his class. And he's having some issues with rejection.
Mm.
What do you do when, they're having these issues with rejection and they want to feel loved, but it's hard to really explain to him exactly how to process that phase in life.
Kristen, what do you think about what Queen's saying about the 9-year-old?
Queen, thank you for calling in. And I think that oftentimes we do see children in school as early as, 9 and even before who have those self-esteem issues. They're getting rejected, they're getting bullied, and they're having those difficulties with those interpersonal relationships and just their overall sense of self. And so one of the things that I like to work with my parents on is just being able to play off their strengths and really focusing on what the child's strengths is and really playing that up and sort of hype them up. Hey, you know what? This little, this person might be having difficulties with you, but let's look at all of the other relationships that you have and all of the great relationships you have. And let's talk about things that you're doing well with them and see how you can then incorporate that into new friendships. Because it can be, a downer for kids who feel rejected and they want friendships. We all want companionship. So just being able to play on their strengths and really talk about what they do very well. Yes.
And Queen, since you knew that his dad had a mental health diagnosis, as you said, were you looking out for something or were you hyper vigilant because you knew his background and history?
Actually, I was. I was trying to find some type of help for him early on because as an infant, he used to have he had a difficult time with sleeping. And even early when he was 3-4 years old, he was having issues in different child care settings as far as his behaviors, and trying to actually get him diagnosed early was very difficult. It seemed like I couldn't find anywhere in this area that could cater to children that young. I was usually told that he was too young to come up with a diagnosis, and he was just recently diagnosed last year.
Wow.
Actually.
And that is something that's important as well because you know that child. And for someone says, oh, no, absolutely couldn't be that. You say, well, but no, I know him. I know how he's acting. I know his background.
Exactly.
So that is important that you stood up for that. Queen, thank you so much for calling.
Thank you.
Miss Benita, and might I add, another thing that's important is just social interactions in general with children. So another thing that I would suggest is being able to find different interests of the child and then maybe exploring those with extracurricular activities. Because sometimes it's easier to form friends when it's a common interest. So maybe it's basketball or maybe it's soccer or, some sort of
chess club or
chess club,
anything
cooking,
like that.
whatever it is. So being able to really get them to be focused on their strengths and not necessarily what they are having some challenges in.
And when I was reading, again, preparing for the show, it said sometimes, and why I'm pushing so much the notion of parents getting them involved in activities, as you mentioned, and them going to bat for their children is that because sometimes children, they don't have the language. She said he was too young to be diagnosed at first. So if this child is 1.5 or 2 or 3, he doesn't even have the language skills. So it said sometimes they don't know how to say what they're feeling. They don't know how to describe what they're feeling. So you, as their advocate, you've got to get in there and say, no, this is what's going on. And that's the important part. So have you been that person for your child? Give us a call at 757-823-9110. Hampton Roads Voices on Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. I'm Benita Adams, and this is Hampton Roads Voices, where people speak life into their communities. Let me go ahead and give you the phone numbers right off the top because it's not a conversation without you. We're talking about black children and mental health. The number is 757-823-9110. That's 757-823-9110. We do have our in-studio guests with us today. We have Cynthia Toy. She is a licensed clinical social worker from Transitions Therapeutic Services. Cynthia, thank you for being here today.
Thank you again for having me, Benita.
We also have Kristen Bates, also a LCSW with Kempsville Center for Behavioral Health. Kristen, it's been a pleasure for you being on our show today.
Thank you. It's been a pleasure as well.
And Dr. Earl Williams, Director and Owner of Psychological and Forensic Services. Dr. Williams, thank you again for being here today.
Glad to be here.
So we've laid the foundation of mental health issues. We've heard from some of our callers. Again, that number is 757-823-9110. Let's go ahead and jump right to the phones because we have a caller on the line. Caller, what is your name, please, and where are you calling from?
Hi, my name's Victoria, and I'm calling from Norfolk.
Okay, Victoria, what is your question or comment?
Well, my comment, I just wanted to kind of contribute. I'm younger, I don't have any children, but as a person who has been in the school system with mental issues, as you might say, how I wanted to be treated, how my mother was there for me through it all. I just wanted to say, I didn't have. Let me start by saying that when we're in school, we're in a prison-like atmosphere. There's bells, you go, you follow in straight lines. Mm-hmm. You go, you're passed off from one warden to the next, and you're expected to not act like a criminal.
Right.
So I see so many of my peers, they are acting out, quote unquote, but, they're just in, four closed walls. And I feel like if our parents were to contribute to the school system itself and change from the normal routine, I feel like maybe a little bit of arm room, elbow room to exercise ourselves, to learn in a different way. I'm sorry.
So are you saying, Victoria, are you saying that the way children are treated or taught in the public school system should be different? It should be more flexible, more open? Is that where you're headed with that?
Yes. That is what I do mean. For someone with, depression, mm-hmm. It was hard for me to wake up in the morning. I'm not a morning person. I missed a lot of class. I still passed pretty well because, my teachers, they worked with me. They could understand even if I didn't explain all the way,
right.
But for you to expect every child to act the same and sit in their desk for 2 hours and watch the clock go by, that can put you in your own head.
Absolutely.
And yeah, that's all I want to say. My mother was there for me. She supported me when I couldn't go into school, or just miss my first class, and she supported me, and I'm still educated. I was able to find myself. That's another thing I've learned growing up, meditation, finding myself centered, and we're focusing on myself before I focus on someone else's opinion of me or what their grade is going to be for me, what my teacher thinks my work is doing. It's a lot of pressure, and I think that parents should, get involved in the school system itself to understand that it hasn't changed since they've gone to school.
Right, and there are a lot of pieces. Victoria, thank you so much for that call.
Thank you. Appreciate it.
Cynthia, what do you think about what Victoria said in terms of flexibility and change? And each child is different.
Yes, and one thing that comes to mind is, parental involvement, parental support, that's vital because every child's needs are different. And it's going to take that parental involvement to be able to communicate some of those things to the school, because a lot of times the child, they may want to communicate, but they may be seen as being disrespectful or not following the directive. So having that parental support to come in and be able to say, these are some of the needs that my child has, these are some of the supports that my child needs, is going to be very important.
So I also think that, I'm sorry.
Dr. Williams, go ahead.
I also think that, and I don't even know if it exists anymore. There used to be a thing called the PTA, where Parent and Teachers Association.
I think it's still there.
Oh, well, good. My children have been a long time out of school.
I understand.
At any rate, I think that more parents need to get involved in their PTA so that they can have some input into school policy, because while every child is different and an individual, there's nothing that's going to that's going to cater to our individuality. We all have to deal with generalities. No one's going to deal with your individuality. You have to deal with the whole general public. So that means that whatever changes that are going to be made in a school are going to be made in the forms of policy. And the only way you're going to have any input into school policy is to go to the PTA.
I hear what you're saying, Dr. Williams, and I hear what our callers are saying. But here's a scenario. I'm going to play devil's advocate for just a second. I could hear a single mom saying, look, I'm working 2 jobs here. I got 3 kids or 4 kids. I don't have time to go to the PTA. I don't have time to go up there and talk to that teacher all the time. I'm doing the best I can here. Kristen, talk to her.
Sure. And I also think as well as the PTA that it's even more on a macro level, and we have to vote because Virginia's school systems are very data driven with the SOLs. And so the teachers have a hard time trying to be flexible with their teaching because they are very scrutinized by the testing. And so sometimes the teachers are doing their very best trying to manage everything that's going on, but it's difficult. So, aside from joining like the PTA and other school associations, this is a more broad issue that affects many, or all of our schools in Virginia. But to the single mom who says, hey, I can't join the PTA, I can't come up here, we have to make the time. We have to make the time, because if we're not making the time, then, different things can happen. The meetings are going to go held without you. Your voice at the table isn't going to be heard, and your voice is so important in looking at the whole child. We just don't want to look at a piece of the child, but we want to look at the whole child. We want to know how they're behaving in school. We want to know how they're acting at home. We want to know how things are in the community, and the teachers can't, and the people who are making the decisions can't make an accurate assessment and can't, form an accurate plan if your piece is missing. And so even if it's sending someone on your behalf, it's so important that the parental voice is heard. And so, we have to make that time. Even if it's communicating via text or email, it's always important to just keep in contact with the parent or the teachers.
So who's qualified to counsel in the school system? Who is there to work with the K through kids school? And is there a shortage of qualified professionals? Dr. Williams, I want you to take that one. So who's qualified in the school system to work with these kids?
Well, actually, there are not a whole lot of people in the school that are qualified to do that. You can have school psychologists, and what the job of a school psychologist is to evaluate the child, see if they need to be in specialized classrooms, see if they are qualified for special treatment. and or if they need to be retained in grade or whatever, to help them keep up with the cognitive aspects of school. I guess some schools have counselors, but they don't. But that's not the same as a therapist. That's not the same as a psychologist. That's not the same as a social worker. There really aren't any people in the school qualified to do therapy. And sometimes it takes a little more than just counseling, and it takes psychotherapy in order to help a child make it through the day.
Ms. Benita, some school systems do have school social workers, and they are master's levels, or some school social workers have their license. So just to be clear, when we're talking about diagnosing, the school psychologists, the school social workers who sit on the team, they're able to make educational diagnosis.
Right.
So when we're talking about looking at, outside outpatient therapy, or we're talking about exploring medication, that has to come from a credentialed person outside of the school building. Those licensed or those social workers in the school and those psychologists in the school aren't able to make those medical diagnoses, only educational diagnosis.
And so the child needs to be referred to a person who can do that for them?
Exactly.
Yes.
Okay. They need the referral.
Exactly.
Now, how does
it be outside the school?
Outside the school. So how does the parent walk us through that just a little bit? If a parent is saying, I don't even know where to start, should the parent go up to and talk to the teacher or the principal, and then go to the school nurse or the clinical worker there in the school? Walk a parent through that right now.
Well, there's a lot of places where the parent can start.
Okay.
One is with the PCP.
Okay, PCP, right.
They're a physician, because, physicians, although they're not trained specifically in mental health, they do know something about it, and they are able to do prescribed medication, But like I said earlier, I really think that medication should be used as the last resort and not the first resort, But the PCP can give a referral, to a mental health facility, and they can do everything that needs to be done, like the psychological testing that might need to be done. Because I've done a lot of psychological testing for people that were diagnosed with attention deficit hyperactivity disorder, and then after that, then the person gets passed down to either made a referral to a social worker, especially if it's a family issue going on, or to a psychiatrist if there's a medical issue going on.
Absolutely. So, but they can start right there. Kristen, did you want? Cynthia, go ahead and jump in.
And I was just going to say also, sometimes in the school systems, the social workers will have some list of providers that they can provide for the parent.
Good.
For outside therapy, as well as just looking on the back of their insurance card and calling that phone number for behavioral health. And there's usually case managers for each insurance company, and they can also provide you with a list as well of approved providers.
Really practical. 757-823-9110. Have you not known where to start when it comes to your child? Has he or she been diagnosed perhaps properly or improperly? Have you been an advocate for your child? Call in Hampton Roads Voices, 757-823-9110. Hot 91.
Is Hampton Roads Voices on Hot 91.
Hi, everybody. I'm Benita Adams, and welcome back to Hampton Roads Voices. We're talking about Black children and mental health. We have Cynthia Toy from Transitions Therapeutic Services, Kristen Bates, a licensed clinical social worker from Kempsville Center for Behavioral Health, and from Psychological and Forensic Services, Dr. Earl Williams. We've had a great conversation so far, and we invite you into the conversation. We have someone on the line. May I have your name, please, and where you're calling from?
My name is Lisa. I'm calling from Virginia Beach.
And your name is, I'm sorry. Can you turn your radio down just a tiny bit?
My name is Lisa. I'm on the Bluetooth for my car, so do I need to turn that off?
Just turn it down just a little bit.
Is that better?
Mm-hmm, because I was hearing no, turn it down just a little bit more because I'm hearing myself. I'm hearing the feedback. Okay.
Okay, I turned it off.
Okay, excellent. So what is your question or comment, Lisa?
Well, no, I was just commenting. This really, my son has been in the CSEP program since second grade. And now he's 18, and he has gotten in trouble as far as he's had an altercation. He's on the autism spectrum, and he also has explosive rage disorder and a few other things, okay? He got in trouble at school with the altercation. They had to call the officers in because he's a big guy. And in result of that, he came away with 3 charges, and all of them were misdemeanors, but we went to court on Wednesday, and they said that they carried jail time, all 3. When he went to court, I wasn't informed that we should have been in mental health court. It was basically an arraignment, and I had to fumble through this and try. I called the lawyer, and they finally got back with me. Now I have to wait for them to schedule it so he could be evaluated to go to mental health court and see if he's competent to stay in trial. Basically, what I was trying to say is that, the behaviors that he's been doing, and I'm not by any means co-signing my son's behavior, but he's been doing them all along. They kept telling me when he gets 18, he's going to get in trouble. He's going to go to jail or whatever. Personally, I don't feel like jail is the place for my son. He clearly has mental illness, and I just don't feel like the system is structured to help kids like this. This is his first, incident with the law, and we don't live in a bad neighborhood. By no means am I a bad parent. I have been involved with my son's situation from day one, okay?
Right.
And I just feel like at this point, it's like he, was in the CSEP program, which I don't think is a great program at all, okay? But he's been in this program for years, and basically he's become a product of his environment.
Kristen, what are you thinking about what Lisa's saying here?
Lisa, thank you for calling. And just thinking about the CSEP program, so I would assume that your son has an IEP, and so he should have been through the process of determining whether his behaviors are a manifestation of his disability.
Kristen, quickly tell us what IEP is, please.
An individual education plan. So a parent or a teacher could go and say, hey, these are the difficulties a child is having. Let's come sit at a table, assess, and see if they need specialized education to help meet their needs at school.
Okay, excellent.
To access the general curriculum. So that's what an IEP is. So, it should have been a process where she went through, or Mom, you went through.
I did. I do the IEP every year. We have the IEP meeting. I've even tried to get him out of that setting and get him into a different setting because I felt like it was just too much stimulation for him. Of course, they didn't honor it. Now they're talking that, but now my son is in trouble. He does have explosive rage disorder, so I know you guys are familiar with that. So that is a direct symptom of one of his disorders. You can't just handle him any kind of way because he's going to feel threatened, and he's a big kid, like I said, and he's going to react.
And Mom, I would, I'm not sure what his classification is. I heard that, he has a diagnosis of autism spectrum disorder as well. So I'm not sure what in school his classification is. But I would talk and sort of go through that manifestation process to see, hey, my son's behaviors, is this a symptom of his diagnoses, or if this is something else? Because if this is a symptom of his diagnoses, jail time isn't going to be fitting for what he's done. And I do think that there are some challenges with helping schools and teachers understand, the behaviors of children who have mental health diagnoses, and that, we have to make sure that the consequences for those behaviors are appropriate.
And you're correct. And I do know that, I've been, like I said, I've been in the trenches with my son from day one, since he's been in the 2nd grade. So, I'm pretty, I'm on the key with knowing what's what as far as his diagnosis and symptoms, and he's on medication, and I research everything because I want to make sure that I'm doing the best by my son, okay? But what I'm feeling now is that it was almost like they waited till, he's going to be 18, but he's still the same child with those disorders.
Right.
That he was when he was in the 2nd grade, when he was in the 6th grade. So now it's like all of a sudden now you're going to hold him accountable as you would, and I hate to say quote unquote normal, like you would a normal person, but taking in consideration my son being he's 18, when we went before the judge, I couldn't go up there with him. The judge asked him a question. his principal was there, his principal at the school, and the police officer who took out the charges on him. They were standing up there with him. The judge asked him a question. Clearly, the principal of the school knew that he wasn't competent to understand what the judge was saying, but no one said anything. It wasn't until the bailiff of the court saw my face and saw how, I was very upset that she asked me, was I his mother, and I could come up. So I had to speak on his behalf. And I just really, really felt bad for my son. And by no means I want him to feel like he can get away with doing things. But I thought about all the men of the people that are incarcerated right now with mental illness. They had no one to stand in the gap for them.
Absolutely.
I'm going to fight for my son. I'm going to do everything I can. And I'm constantly in his ear telling him the right thing to do. You understand? But my thing is that when they turn 18, it's like they throw them away as if they don't have the disorders anymore.
Dr. Williams, go ahead. Lisa, I'm going to
Okay.
have Dr. Williams make a comment on that. Stay on the line.
And I hope my phone don't die because I'm really, I'm really full and I have a lot to say. And I just really want to be an advocate for people in my son's situation.
Let me just get a word in here for
I'm sorry,
for
sir.
a second. Let me just
Okay.
get a word in.
Go ahead.
My name's Dr. Earl Williams. I'm a forensic clinical psychologist. And one of the things that you're going to want to do is to, first of all, you want to get an evaluation to see if he's competent to stand trial.
Right. They told me I had to do that.
All right. So that's what a psychologist does, not a
Well,
social,
the
not a
court
social.
said they have, the court
not a
said
social.
they have someone to do it.
That doesn't mean that you should take that person.
Okay.
You're going to have
sir.
you're going to have to think about this.
Okay.
So that's the job of a clinical psychologist. All right. And what a competency to stand trial means is, does this person know enough about the law to aid to help themselves in a court situation, in a trial situation? Do they know, what is the job of a judge? What's the job of a jury? What is the job of, what does taking an oath mean? And questions like that, what is the job of a Commonwealth attorney, the defense attorney, the judge, all of these things, So the other thing is that in the state of Virginia, you cannot have a sanity at the time of offense evaluation if you're a child. But if you're 18, you might be able to get away with that. If you have, in addition to the competency, a sanity evaluation, then you can talk about things that might be in mitigation of your son's behavior.
Okay.
That's where a psychologist will relate the diagnosis to the behavior. And if there's mitigation there, then the judge can take that into consideration, even if he is not found to be insane at the time of the offense, because he probably wasn't. But still, if you get that type of evaluation, both the competency and the sanity, it's called the MSO, evaluation.
MSO.
Yep. You want a CST, competency to stand trial, and an
CST.
and an MSO, mental state at the time of offense evaluation. Then they can talk about his diagnosis and how that relates to his behavior.
Okay.
Because if his behavior is a direct result of his diagnosis, then he may not be held responsible for that particular crime.
And Lisa, we'll definitely have Dr. Williams give his contact information at the end of the show. But it seems like so many of these things that you've already done. But I hear what you're saying, and I can hear some of that frustration in your voice because you've been there all along, as we've heard our experts talk about. You've been your son's advocate. And now you're saying at 18, all of a sudden these things are piling on. So we so appreciate you giving us a call. But at the end, Dr. Williams will give his contact information as well as Ms. Toy and Ms. Bates. And we so appreciate your call. Thank you so much.
Thank you. Thank you so much. Bye-bye.
Bye-bye. Again, this is Hampton Roads Voices. I'm Benita Adams, and we're talking about Black children and mental health. And so, Kristen, you heard exactly what Lisa was saying. And again, there's so many factors involved with this. But I think that information that Dr. Williams gave was so important. Let me throw those numbers out one more time. It's 757-823-9110. 757-823-9110. Stay here locked on Hot 91. We'll be back right after this.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody, to Hampton Roads Voices. I'm Benita Adams, and we're talking about Black children and mental health. Now, we just heard from Lisa, and she was talking about a situation about her son. Lisa, again, we really appreciate that call. And sometimes, and she said that she had, as most parents do, they've been those advocates for their children. But sometimes the parent has to make a decision. Should I follow the advice and put my child on medication, or maybe they need what is called talk therapy? So, Kristen, I'm going to start with you. What is the difference there? The medication, and perhaps what types of medication are out there, and versus talk therapy?
Sure. So talk therapy is kind of what we think about when we think about therapy. Someone going into an office or meeting with a therapist to discuss whatever issues are going on. We call that psychotherapy, versus medication, where the medication is treating the symptoms biologically through medicine. So a lot of times they go hand in hand, but you can have therapy without the medication. You can have medication without the therapy. However, I would recommend that if you are seeking medication to help manage your symptoms, that you're also going to talk with a therapist about what's going on. The medication will only help treat the symptoms, but once we start talking and digging and understanding the patterns of the behavior, what it looks like in me, how it affects me, then we're able to also help regulate our moods. When we talk about talk therapy, we're talking about being able to change cognitively how we think about things or how we feel about things. The medication isn't going to do that. You learning those coping skills and being able to internalize them and utilize them is what's going to bring about that change.
So, Dr. Williams, who can dispense the medication?
Okay, only a medical doctor can dispense psychotropic medication or any medication, which means your PCP can dispense medication, and so can a psychiatrist. And I'd also like to add that there are some mental illnesses that require lifelong medication.
For example?
Schizophrenia.
Okay.
Schizophrenia, you're going to be on medication from now on. Bipolar disorder, you're going to be on medication from now on. But adding talk therapy to that will help a person that has those types of very serious mental illnesses be able to cope and adjust to the world around them. So it is very possible that a person with bipolar or schizophrenia could have a very normal life, in terms of being married, raising children, working a job, going to college. I went to a seminar once, a college professor who was a schizophrenic. Mm-hmm. I used to work, when I first moved down here from Boston, I worked at Eastern State Hospital, and there was an attendant there who was schizophrenic. And I said, well, how do you deal with that? He said, I know that the voices that I hear in my head are not real. So those kinds of things are going to require medication from now on.
Is there ever anybody can jump in for this one, is there ever a holistic approach, a health approach, a nutritional diet exercise approach? Can that help, or is that just a piece of everything that we're saying?
I definitely think a holistic approach is very vital, because when you think about mental health overall, it's not only just about your emotional well-being, it's about your physical well-being as well. A lot of times when you're going through certain things such as depression and your eating habits change, things like that, there's a lot of weight gain or weight loss, things like that still have to be managed. Thinking about when he was just talking about medication and things like that, there's different side effects of medications, and you still have to be able to manage those things with medical practices. You have to do that holistically.
And there are other treatments for depression, because not every depression is clinical. When you really think about it, all of us have been depressed sometime or another in our lifetime,
Mm-hmm.
And that there is such a thing as exercise that will elicit hormones that combat depression, So there are a lot of holistic, there are people that have seasonal depression, which is the kind of depression that happens in the winter, and you live in a climate that has shorter days and longer nights in the wintertime. And they do light therapy,
Right.
You know, that is to be able to sit under a really bright light that mimics the sun, you know, for a little while every day, and that will kind of alleviate some of the seasonal depression type of things. There's postpartum depression, you know. See, there's just so many different things out here that you can do to treat yourself, you know, without medication, you know, and one of them would be exercise, counseling, and taking up a hobby. You know, there are all kinds of different things, you know. It always occurred to me, whatever your depression is telling you to do, you do the opposite.
The opposite. And we had mentioned before, because we're talking about children, getting them involved maybe with a sport, or getting them involved maybe a church or place of worship.
Or some extracurricular activity.
Extracurricular. Let them take up an instrument or something. So, Cynthia, if a person says, yes, I want to be involved with talk therapy, what should that parent expect? How many sessions, perhaps? How does it work out? ABC, 1, 2, 3. Give us some things with that.
And so with that, I always sit down and talk with them about how the first session will go. Because within the first session is when we do that assessment. So we sit down and talk about, you know, what's going on with the family? What's the family history? What's going on currently? How long have things been going on? So we do a complete assessment during that first time. And that's when we're able to see, you know, how many times out of the month or out of the week should, you know, this person come in for therapy. And the length of time, you know, just kind of depends on what's going on. So I usually don't say, you know, you're only going to be here for 6 sessions or you'll be here for 20 sessions. It's just we'll look at what coping skills have you been able to develop? Have you been able to utilize those coping skills? And just like we talked just a minute ago, some of those coping skills will be to include the exercise. For some people, it may be to include prayer. For some people, counseling may not only just be individual, but it may be family as well, to increase those communication patterns between the child and the parents.
Now, how do you manage their expectations? They said, okay, I get to come for 6 months or 3 months, and when I'm finished, everything's just going to be all better. How do you manage those expectations? Because maybe that's not going to be the case for that particular person.
And one thing that I also go over with them is expectations during that initial session. And we talk about what are they looking to get out of therapy. And then I talk about what my role is in therapy as well as what their role is. Because therapy is going to be some work. You're not just going to come in and think, okay, well, now she's told me what to do, and now I'm cured. It's not a magical pill. There's going to be some work that's involved with it. We're going to talk about techniques. We're going to talk about how you're feeling. We're going to process your emotions and how to appropriately deal with them. And then also you practicing them outside of being in therapy as well.
And if I might add, you know, the practical piece of the talk therapy is the professional giving you those tips and those strategies to be able to help manage your emotions. And they're also going to be able to help you point out what your patterns are, because our goal is for you to be able to self-regulate, for you to be able to manage your symptoms. And oftentimes in the Black community, this is where we can kind of go astray, because we seek out help, but we don't seek out professional help. And so we might seek out a family member, we might seek out a friend, and they might be able to process and talk with you through things, which is great. However, sometimes we need that professional help, someone who's able to really look at the symptoms to help you identify what's going on and to help you manage it.
I think that's important. I'm so glad that you said that in the Black community. I come from a very religious family. My father was a pastor. And so I've heard all my life, well, just go and take it to God in prayer, and that's good enough. And that is good. And that's important. But
that is good.
There is a time perhaps where you need to go beyond that and go to the professional. Dr. Williams.
Yeah, actually, I think that when you're dealing with mental health, you should use everything you've got to combat it. Now, I've written 3 books. My first book is Psychology from Scripture. And in my first chapter, this is while I was working at Eastern State Hospital. And my first chapter, I talk about the relationship between mental illness and spiritual warfare. You know, and I think that there is a connection. And for some people, that might work. You know, so use everything you've got. You know, use your resilience, use your race, use your gender, use your spirituality. I tell people, don't leave anything at home. We're going to bring it all into office, and we're going to use everything you've got.
Everything you've got, the holistic approach. So what have you done with yourself, with your child, in terms of staying mentally healthy? The physical, again, connected with the mental health. Again, the number is 757-823-9110. 757-823-9110. We want to hear from you. Hampton Roads Voices on Hot 91.
Is Hampton Roads Voices on Hot 91.
Welcome back, everybody. We're talking about mental health and children, especially in the Black community. We have our guest experts with us, and right before the break, we talked about how important it is to have a holistic approach in terms of this. We talked about medication versus talk therapy. But I want to look a little bit at Cynthia. I want you to talk about talk therapy, but how effective family counseling is. It isn't just, okay, honey, you're going to go on to the therapist now. Talk about why it has to be a family matter as well, why it is.
Yes, family therapy is very important because it is a family matter. When we see a lot of people come in and they'll say, this is what's going on with my child, fix it. Fix him, fix her. But the thing is, it's a whole family issue, and the whole family needs to work on change. The whole family needs to learn those coping skills. The whole family needs to learn how to regulate their emotions, because a lot of times what the child is displaying is a symptom of something within the family. So let's say, for instance, you have a child that's acting out or, having tantrums. A lot of times they'll say, oh, well, get my son to listen, get my daughter to listen. But we have to think about, how is the family communicating? Mm-hmm. And family therapy is a way for them to be able to communicate the feelings, because a lot of times those behaviors are just symptoms of other things that are going on. And that family being able to come in and do family therapy, a lot of times the child will share more things about what's going on, how they're feeling, things that they really feel like need to be changed or adjusted, or different things that may be going on. And they feel safer in sharing those things in family therapy. And they learn, more tools to be able to communicate effectively, instead of the yelling, instead of, just walking away and not dealing with the situation. So it's very important. If we want to see change in one family member, then there has to be change within the family as a whole.
I think that piece is critical, very much so. So we've had in our studio as our guest today, Cynthia Toy. She is a licensed clinical social worker from Transitions Therapeutic Services. Cynthia, how can they get in contact with you?
Yes, I have 2 numbers that I can be reached at. One number is 757-349-8740, and the other number is 757-675-4075.
Can they find you online anywhere?
Yes, I've actually, whenever someone comes in, I always ask them, how did they find me? And a lot of people say, I Google Black therapist, so I find that, and, whatever works is fine. I'm also on Psychology Today, and that's the way a lot of people have found me as well.
Thanks so much, Cynthia Toy, Transitions Therapeutic Services. And then our second guest was Kristen Bates, also a licensed clinical social worker from Kempsville Center for Behavioral Health. Kristen, how can they find you?
Sure. You can find me at KBATES 8710 at gmail.com. Again, it's KB as in boy, ATES 8710, or you can reach me at 757-455-0273.
Thanks so much for being here.
Mm-hmm. Thank you.
And then Dr. Earl Williams, Director and owner of Psychological and Forensic Services. Dr. Williams, how can they find you?
Well, I am no longer doing psychotherapy, but if you have a question, I have no problem answering any question that you might have. I can be reached at 757-348-1529, and you can Google me, you can Facebook me. I'm going to start a YouTube channel where I'll be answering these kinds of questions, for people that might have something that they need to know about.
This has been such a fantastic conversation again, and it is so important and such a conversation that we need to have. So many times we know that in our Black communities, it's almost a stigma, and we really don't want to talk about it. But not only do we have to take care of the physical health of our children, but we've got to take care of the mental health of our children as well. And so sometimes we have to say, my child is acting out, or is my child having a bit of a problem? Is this a mental health issue, or is this something else? And how do I approach his or her teacher? How do I get in there? We've heard from our callers and say that they've had to be advocates for their children, and that's what we're talking about today. Should it be medication, or should it be talk therapy? We've looked at all of that. So Hampton Roads Voices, my contact information is bkadams@nsu.edu. Also, don't forget, you can find us at the broadcast. We rebroadcast this every Sunday from 12 to 2 here at the station. And also, don't forget that we put this online on our YouTube channel, Hot 91. Also, don't forget Facebook and Instagram. You can find us, but again, or you can find me at Benita K. Adams. That's on Facebook and on Instagram. So it's been a wonderful conversation. We thank you for being here. And next week, we have a lot of good things in store for you. So you want to be sure that you call us and that you contact me and let me know, what do you want to talk about? So Black children and mental health has been our issue today. Hampton Roads Voices on Hot 91. Thank you for listening.
It's Hampton Roads Voices on Hot 91.
The views and opinions expressed on this program are not those of Norfolk State University or WNSB FM. Thank you for listening.